Hello, my name is Mark Sherman. I'm a surgeon at Surgical Associates of La Jolla in La Jolla, San Diego. I work out of Scripps Hospital. And I thought I'd take a few moments to describe to you a procedure that can be very effective at stopping your reflux. It's a procedure that's been around actually for quite some time, but there are certain nuances to ensure that it's done well and done correctly. And that procedure is called a laparoscopic Nissen Fundoplication. Now, Nissen was the name of the surgeon who first described this, and as I was told back in my training, the procedure came about because this surgeon operated on somebody who had a hole in their esophagus. They were very sick, and a hole had developed in their esophagus, and this surgeon went in and repaired that hole. But in repairing it, he reinforced it by using a portion of the stomach as a kind of a seal over the esophagus. And the patient was very grateful and essentially said, "Doc, thanks for saving my life. And also, thank you for stopping my reflux." Well, we had a smart surgeon who kind of thought about what he did, and that procedure evolved to the laparoscopic Nissen Fundoplication that we perform today. So what that procedure entails, and I have a little model here, is if you look, imagine I'm holding the stomach in my hand here, and the white tube here is the esophagus. Food goes down the esophagus into the stomach. And right here is the Gastroesophageal Junction. Gastro meaning gastric, esophageal, the esophagus, and that junction is where the two meet. And normally in that area there's a sphincter. That sphincter is a muscle that can close and narrow down when we don't want things to go through the area and open up when we do. So when we swallow, that sphincter at the junction here will open up and allow food to go into the stomach. But when food is in the stomach, we don't want it to come back up, and that sphincter will tighten down and help prevent things from coming back up. The problem with reflux is that sphincter may not be working well. Now, there can be some other issues that contribute to reflux as well, but oftentimes that's one of the key issues, is the sphincter there not working as well as it could. The problem with that is now acid that's in the stomach will come back up into the esophagus and cause that burning, pain, pressure that we feel with reflux. So the procedure that can be performed is a laparoscopic Nissen Fundoplication. Laparoscopic means we use small incisions and a video camera during the time of anesthesia while you're asleep and in the operating room. And these incisions are all, let's say the largest one is only 1/2 inch, and the others are about 1/4 inch incisions for our instruments. And with that, I can see the area where the esophagus is coming into the abdomen. The esophagus actually comes through the diaphragm, so there's an opening in the diaphragm. The esophagus comes through that opening down to the stomach. And laparoscopically, we can reach up to this area. The first thing that we do is fix a hiatal hernia. A hiatal hernia would mean that some of the stomach is actually up in the chest. So if we were, imagine from your camera's viewpoint, looking inside, right now all the stomach is down in the abdomen. But if somebody has a hiatal hernia, some of that stomach is up in the chest. Up here is where the lungs reside. The issue that arises with that is every time you take a breath, you're sucking air into your lungs. Well, if some of your stomach is above the diaphragm, it's kind of sucking gastric juices to this part of the stomach, which is right by that poorly functioning sphincter, and it helps contribute to reflux. So the first thing we want to do is fix a hiatal hernia. So laparoscopically, we pull the stomach down into the abdomen, and we put some stitches in this area to make it so that the stomach can't go back up into the chest. Then we get to the laparoscopic Nissen Fundoplication part. And what that entails is this part of the stomach is referred to as the fundus, and there's some attachments to structures around in the area. We free up a few of those attachments and make a little space right behind the esophagus and just bring a little bit of the stomach behind the esophagus and sew it to the stomach in front of the esophagus. And it just creates a little wrap right at that gastroesophageal junction. We don't make the stomach smaller. This is not a weight loss procedure. But what this does do is it allows food to easily go down into the stomach. But if any food, juices, anything in the stomach tries to come back up, part of it will go into this wrap that's around the junction, causing that wrap to swell and pinch off, and it prevents anything from actually going up into the esophagus. And it's a very effective procedure when done correctly to help stop reflux. there can be side effects and issues, and that's why I would encourage you to find a surgeon who is very skilled at this procedure, knowledgeable in the techniques, and knows what things to do to try to minimize those side effects and ensure that you have the best possible results. Here at Surgical Associates, I'm happy to talk to you. Feel free to contact us at the website listed below or call us for an appointment. We'd be happy to see you at any time and discuss issues regarding reflux and this procedure.